The Achilles tendon is the largest tendon in your body. We can't walk without it. A common injury to this tendon is called Achilles Tendonopathy, replacing the old term Achilles Tendonitis. Repetitive loading stress on a tendon causes it to degrade over time. The initial stage is inflammation and swelling. As the damage accumulates, the tendon becomes thickened and unhealthy. It is only a matter of time before it ruptures. This can happen to athletes like runners, dancers, tennis players, etc. Training in inappropriate footwear, incorrect training techniques, or rapidly changing the intensity of training. It can also happen to people who are inactive or overweight, or people with high blood pressure, high cholesterol, or diabetes. About 6% of inactive people develop Achilles tendinopathy at some point in their lifetime. When you have Achilles tendinopathy, there's pain and stiffness at the tendon. Morning pain is a hallmark symptom. The progression of the condition is usually gradual, so if instead you feel severe pain and loss of ankle strength that comes on suddenly, it may be Achilles tendon rupture instead. So what are the physical signs of Achilles tendinopathy? Well, pain can be felt by pinching around the tendon. There may be swelling or thickening of the tendon. Activities that load the tendon, such as climbing stairs, will increase pain. And aside from Achilles tendinopathy, which is usually located 2 to 6 centimeters above the back of the heel, there are variant conditions that exist, such as pain at the attachment of the Achilles tendon into the heel bone, called insertional tendinopathy, or inflammation of the bursa at the base of the Achilles, called Retrocalcaneal Bursitis. Insertional tendinopathy management is different from Achilles tendinopathy management. Insertional tendinopathy can be aggravated by stretching rehabilitation exercises, because that is meant more for Achilles tendinopathy. Accurate diagnosis is important in these cases, so imaging studies can be useful for making that differential diagnosis, that is, to rule out conditions mimicking Achilles tendinopathy. The first-line treatment for Achilles tendinopathy include rest, ice, rehabilitation exercises, taping, night splints, and painkillers. Damage from chronic degenerative tendinopathy may be irreversible and won't resolve with simple exercise. So there are specialist treatments that are not surgery. For example, foot orthotic insoles, ultrasound iontophoresis, extracorporeal shockwave therapy, and platelet-rich plasma injection. Achilles tendinopathy starts with reactive tendinitis, which at first may not seem that bad, but it progressively worsens into tendon degeneration over time. Early diagnosis and prompt treatment is key to successful recovery.